We all want the best for those we love. So when the time comes to find outstanding medical care for our children, then more than ever, we want the very best. Well, if your child has an orthopedic problem, then the very best is Shriners Hospitals for Children St. Louis, where we have been providing comprehensive care for children with conditions of the bones, muscles, and joints since 1924. The hospital in St. Louis is part of the Shriners Hospitals for Children International Healthcare System, with hospitals in the U.S., Canada, and Mexico dedicated to improving the lives of children through pediatric specialty care, innovative research, and outstanding teaching programs. Shriners Hospitals for Children have been providing state-of-the-art care since 1922, when the Shriners International Fraternity opened its first pediatric orthopedic hospital. Every year, more than 100,000 children receive expert, family-centered care for orthopedic conditions, burns, spinal cord injuries, and cleft lip and palate. Any child from birth to 18 years is eligible for care at a Shriners Hospital if there is a reasonable possibility they could benefit from our services, and there's never a charge to patients or their families. And while services are provided at no charge, don't mistake them for being anything less than exceptional quality.
At St. Louis Shriners Hospital, we care for infants, children, adolescents, and young adults with musculoskeletal orthopedic pathology. We provide those patients very comprehensive, excellent, state-of-the-art care.
At the St. Louis Hospital, there are places for patients to play, places to learn, places to unwind, and places to facilitate healing and recovery for children from a large catchment area.
Here in St. Louis, we treat children from Missouri and the 8 surrounding states and all over the world. We are the pediatric orthopedic center in the Midwest.
And with some of the country's top orthopedic surgeons, specialists, and consulting physicians here at the hospital, every aspect of a child's treatment can be carefully considered and provided in a safe environment, with treatment options made available as soon as they are needed. It all starts with our interdisciplinary approach to care, where parents are at the heart of the team, fully involved in decision-making. Every day, physicians, nurses, therapists, clinicians, and technicians share information and ideas so everyone understands what has to be done to ensure the best possible outcomes and help our kids defy the odds.
Ever since we came here, they've been talking with us step by step on what they're going to do for him and how we can help.
They kind of let us know our options, and then we can choose whatever is best for us.
The medical team at the St. Louis Shriners Hospital has a focus on outpatient care, holding specialty clinics every day where health professionals can evaluate a child's condition, recovery, and future needs. Many of the patients that come here to Shriners Hospital don't need surgery, but for others, surgery can be their only option.
We have the best surgeons. We see things that other hospitals don't see very often. Things that are rare for other facilities are pretty common for us.
Our goal is to help these kids return to the highest level of health and function possible. When they leave, they'll have mastered adapting to change and be highly competent in the activities of daily living that they'll need to succeed and create a life that they perceive as meaningful. The rehabilitation offered at the St. Louis Shriners Hospital is truly comprehensive. Physical and occupational therapists work hard with patients to help them achieve their full potential.
I've never had a physical therapist before, but I mean, they're pretty nice, so they work with me.
Sports and recreation therapy provides a structured opportunity to let off a little steam, manage weight, interact with others, and just pursue the fine art of having fun. When necessary, children have just the right orthotic or prosthetic device made especially for them, crafted by technicians who work closely with each child's entire care team without having to make any compromises.
Some of the members of our team started out as patients here. So by talking to them, we're aware that the attention to detail and quality and the caring makes a big difference on how they feel as patients.
Every child we serve gives our very best every single time.
The staff at the St. Louis Shriners Hospital is dedicated to more than just addressing physical needs. We are concerned with the health and well-being of the whole child.
I love the staff here. They're really friendly people, and they care about you, and if you have a question, they'll take time to answer the question, which is really nice.
Surgery and rehabilitation can be difficult, and so we try to make things easier by making them enjoyable.
We have medical play dolls that we get out, and we let the kids use the medical equipment on the doll, so they actually get to be the doctor, which is really fun for them.
I had so much fun. I got to put a cast on the doll's leg just like mine.
Child life specialists help kids just be kids, playing, participating in arts and crafts, making music, and much more. But this fun has a serious purpose, to keep kids growing developmentally while they get better. The most important part of recuperating is being part of a family. So the St. Louis Shriners Hospital has made it a priority to involve family members in all aspects of care.
It doesn't feel like it's just a job to these people. You know, you feel so comfortable and you're just really a part of things.
It's not like you're a patient here, it's more like you're part of a family.
When it is necessary for a child to stay in the hospital, a parent can sleep in the room with their child, or we have separate parent quarters.
You know, we always have the option one parent can stay in the room with him if he needs that extra comfort, or if we need that extra comfort, however the case may be.
I had my mom stay with me almost every night. Having her there was very nice.
Care coordinators are here to help with counseling, housing, even financial assistance, and to ensure that families will have continuing support upon re-entry to their community.
Having a child with a medical problem is very stressful on a family, so we try to help them with transportation, help with their lodging, help with their meals, and just the emotional support they need for what they're going through.
We work closely with schools to make sure that our children can stay on top of their studies.
It's very important that kids don't fall behind in school while they're in the hospital. So we have a classroom that is open 3 days a week, and the children come in every day and we help them with their schoolwork.
For older teens, our Transitions program helps them by offering information about community resources to prepare them for independent living, higher education, and careers. As our patients grow, we can help them see how they can be successful as adults, while our Teen Lounge helps patients enjoy life right now. What can sometimes get overlooked is how much better the care is at Shriners Hospitals thanks to the research we do right here in St. Louis. Shriners Hospitals for Children is committed to an annual multi-million-dollar investment in clinically useful research that will improve lives and increase medical knowledge. For example, researchers at Shriners Hospitals for Children have contributed to the development of effective treatments for osteogenesis imperfecta, discovery of a genetic link to clubfoot, and to improving the survival rate of persons with severe burns.
Doctors from all over the country will send patients here for evaluation and treatment, as well as for research. Because of the generosity of the Shriners Hospital, we're able to evaluate these children in a depth and breadth that insurance companies simply won't pay for. It's a very unusual privilege to be able to work with children to find out exactly what's going on with them. It's an amazing place to work.
We're also proud of our role in medical education. Over the past 20 years, more than 8,000 doctors have completed medical residency or fellowships in the Shriners Hospital's healthcare system. In St. Louis, we also provide training for students of nursing, therapy, orthotics, radiology, and social services.
Here at Shriners Hospital in St. Louis, a great effort is made to combine the knowledge of our staff with that of the greater medical community in general. Together, we're able to solve more clinical scenarios, solve more clinical problems, and take care of more kids.
And because we maintain such close relationships with other medical teaching facilities around the world, our patients always get the latest treatments available. Every child gets quality care at the St. Louis Shriners Hospital. and the family's relationship to a Shriner, their financial situation, or their insurance coverage simply doesn't matter.
We're privileged here at Shriners Hospital for Children not to have to charge the families of the children we serve. This allows the physicians and other caregivers to proceed with only one goal in mind: how best to care for the child without consideration of insurers or other financial concerns.
All of the funding for the Shriners Hospitals for Children comes exclusively from the Shriners themselves, from individual donations, and from corporate giving. When a physician refers a family to the Shriners Hospital for Children in St. Louis, or a family chooses to come visit us on their own, we make the process painless.
Just call us and talk to a member of our team to learn about how we can help your child.
Every child that comes to be treated at a Shriners Hospital knows that they are getting priceless care.
Every orthopedic surgeon we spoke to asked if we'd been in contact with Shriners.
We had the option in our hometown to have the surgery done fully covered, but we still opted to come down here because it is a better source of care.
Shriners International Fraternity is an organization devoted to fun and friendship and helping kids.
I am so grateful to the Shriners. I tear up when I think about it. They are just tremendous people that they would do this for all these children. And the parents, the families, the children themselves will be eternally grateful. Yes? Don't you love Shriners?
They're amazing.
With their distinctive red fezzes, Shriners bring smiles and laughter into their communities and to the children at the hospitals, and do so much more. If you know a child who could benefit from the one-of-a-kind medical expertise, care, and compassion we provide, please call us today, because every child deserves the very best there is. The Shriners Hospitals for Children in St. Louis.
Thank you, Shriners.
Thank you, Shriners.
Thank you, Shriners. You've been really good to me.